Hello, I'm Dionne. I'm a fifth year medical student and I'm currently on my fifth week of placement where I've been doing paediatrics at a hospital in Fife. Hmm. Um, so like I say, paediatrics is new, so it's a bit daunting at first, but it's actually been really exciting. It's been really rewarding getting to work with children. Um, I've enjoyed that. It really shows you how much you need to focus on communication because obviously communication is vital within medicine, but even more so with kids because they really need to build a good rapport with children in order to really get anywhere with them. Obviously, as well, children come in all different, ages, and with that, they have different needs and different things. So you have to really be able to adapt to that, to each child's sort of needs and what works and what doesn't. So kind of getting to grips with that and learning how to do that, it's been really eye opening. But I've really enjoyed that side of it. Um, and I've also been working a little bit on the neonatal unit. So that's with newborn babies, preterm babies. Again, it's all very new, but that's been really nice to do. I got to see a baby being born for the first time. I really liked that. It was a great experience, something that I'll never forget. It was quite emotional. So it's really just going into these things and you are a bit scared at first, you're a bit nervous, but actually just getting out there, going outside your comfort zone, doing things, trialing things, seeing what works and what doesn't. It's been really good for that and sort of showing me what my strengths and what my weaknesses are as well and how I can work on them. But it's been a really good placement and I have enjoyed learning everything that has come along with it. So specifically within the actual teaching that we've had, the doctors, some of them have prepared slides and things, and it's been more of a sort of lecture style, which has been helpful to an extent. I think that lectures will always have a place. It's good to sort of see all the information that you need to know with your own eyes, but actually how much of that you take in and actually remember, I don't think it's ideal. I think the best way to learn is active learning. So actually the best teaching that I had, and luckily most of it was like this, it was sort of discussions and tell me what you know, let's discuss it. We'll talk about what we know and then also what we don't know. And that's when they'll come in and the doctors would tell us stuff about certain conditions and obviously what their area of expertise is in. And then from that we'll talk openly about what we know, what we want to know, and sort of build up a picture of our knowledge as a group. And it was always in a really safe environment. It was always small groups where everyone was allowed to speak. There was no silly questions. If you didn't know something, that's okay. We're here to learn. And just a really good supportive environment. And I think being in those sorts of discussions were really helpful for my learning. And actually, a lot of information has now sort of stuck stuck with me because it was more active learning and just having that approach. I think is ideal. So luckily, a lot of our sort of teaching and things were centered around that sort of approach. So that's been really helpful. So I think at first what's hindered me, and it's probably the same, I would say, for a lot of medical students, when you start out on a placement, your confidence is at its lowest that it will probably be when you start. So confidence is a big hindrance at the start, and you have to overcome that yourself. Nobody's going to take your hand and make you confident. You have to actually get out there and do things to gain your confidence. So at first, I think just being a bit nervous and your initial instinct is you want to hold back, you don't really want to get involved, and actually just you learn very quickly that that's not the best thing because if you hold back and if you don't get involved, no one is going to force you to get involved, really. It's up to you. and you're not going to gain anything from that. So what you actually have to do instead is take a little bit of a leap and put yourself out there, get involved in things. There will always be people around, and I quickly realised that being in such a good supportive team really helped. They understand that you are just a medical student at the moment. You're not a doctor as of yet, and so you still have some learning to do. But you do need to get out there, go on ward rounds, take history, speak to patients, and just gain your experience like that. So that I would say at first probably confidence hindered me a little bit, but it very quickly kind of dissipated, luckily. I'll probably, as well as that, adapting to a new hospital, that was a little bit tough at first. Things are done a little bit differently there. I'm quite used to being in the city hospitals where it's all digitalised notes and things are different. So in these smaller hospitals, not all, but some of them still use paper notes. And that might not seem like a big thing, but actually being on a ward round, trying to listen to somebody whilst also writing down notes at the same time, also trying to document things accurately because it's a legal document, trying to not make mistakes, leave enough room. Also, you're trying to listen to multiple people talking, noting down examination findings. There's a lot of skills that are involved there, and it actually, there's not as much room for error when you're, on paper. So that sort of thing was quite hard to sort of navigate at first and a little bit stressful. Luckily, there were some people to sort of help, but I think the one thing that sort of hindered me was sometimes people just think you know things already, but actually you don't, and it can sound very simple, like just how do I structure these notes? How do I do this? And sometimes you just have to ask, because if you don't ask, people won't know that you don't know how to do it, or you're not sure. So that was maybe a little bit tough at first, but then I just thought, well, I need to ask how to do it. And again, with practice, it got easier, and I feel a lot more confident about doing it now. So that was probably another main thing.